All right, let's go ahead and get started.
Anyway.
That is everybody.
Yeah. So we'll begin with introductions. Kevin Schutte, Mason County Commissioner.
Sharon Trask, Mason County Commissioner.
Dave Wyndham, Mason County Director of Public Health.
Ian Tracy, Environmental Health Manager.
Randy Neville and Mason.
Carrie Davidson, Shelton School Board.
Kathy McDowell, Shelton, or City Council member.
Peggy Van Busker, Cospville District 2.
Okay, very good. Move on to approval of today's agenda and entertain.
Second.
It's been moved and seconded to approve the agenda as presented. All those in favor say aye.
Aye.
All those opposed. Setting our meeting dates. Dave, do you want to just tick those off real quick?
Yeah, so, favorite copy. The only place that we have trouble is fourth Tuesday. And I think the only one had to move was November, and so it falls a week later. And it's January 23rd, March 26th, May 26th, July 23rd, September 24th, and 26th. So we're actually really only like a day off from this current year's calendar.
Okay. Any discussion or a motion?
So second. I'd rather
Moved and second to approve the. Say aye.
Aye.
All opposed? Motion carries. We'll move on now to the health officer report.
The written report here, things that have changed since then, not too much. We have Amendment 16 coming in the contract, and basically this time they're not adding much in the way, and added what's allowable for spending, what's not allowable for spending. So in there for the first time ever. So we'll be bringing that. Well, that'll come out. I can just sign off on that one since there's no money involved. But programs, which doesn't include housing or all that. Use the DOH. So that's coming. We are watching a pneumonia outbreak in so, and that seems to be primarily pediatric from what I'm hearing. So we'll be watching that one. Health business. So we're kind of back in the weeds on that kind of thing. We replaced our substance abuse we've had for several years. So it's a good thing we went ahead and applied for it. Additional grant? Because a lot of the counties thought it was an additional grant, did not apply, and did not get any funds in the coming funding cycle. So DOH did not make it clear when that came out that this was. We met on that in the first part of this month with DOH and with SALFO in Spokane. Not sure what the other counties are going to do to get their funding. So some of them had a substantial amount of money, $200,000, $300,000 in that fund.
So did other counties get an increase?
Or they applied for it as a first time thing, yeah. So for us, it was about, so not as much as we'd asked for, but they were very, how much to ask for. It just was not a very well put together proposal. But we did get, I think 100, certainly enough to continue our expand that to HIV testing, Hep C treatment, all those things we'll be able to expand into. A savings account for money we've received from Cascade Pacific Action Alliance over the last 5 years, which would pay for a vehicle. So we're going to scale this vehicle back a little bit. We're not going to go as, so it might be more like a Sprinter van instead of a larger vehicle. But again, the object is to take. That's coming spring. WIC, we have hired our WIC setting up clinics, and so she comes on board in December. super highly recommended. DOH is really excited, we're really excited. Around the end of January, first part of February. Yeah, so we've got a new hire in finance to replace Stacy, and she starts on December 1st, so that'll bring our staffing back up in that department. We are watching, this is the, make sure you don't bust your spending authority, so we're watching all that closely. But we've got the money in the bank, but we don't have time to do another budget adjustment, so that will wait till next year. As we add these new grants to it, we just got them set up so they don't do a start until January 1st anyway, so. Make things simple for our bookkeeping process. That's kind of the biggest thing coming out of the administrative end of public health. A lot of work going on around the state, a lot of talk around the opioid. Sure, Shooty and I are working on that piece. We're asking to see what other counties have done, and right now, so kind of in the same place we are. I think that's about it.
Okay.
I had something
Yeah.
that when I was reading your report, I was recently at a school directors conference where I went to a breakout session on fentanyl, and the DEA's website, I'm assuming you're probably aware of that, the One Pill Can Kill campaign. They have a lot of different resources that they were saying they update anytime they get new information to change the statistics, but they've got different things that can be downloadable or passed out. Something I think is relevant, especially to schools and educating people. They have things for teens, for teachers, but they have community resources too. And I figured we were probably aware of that, but
Yeah.
it was something I wasn't aware of until I
Yeah.
went to that session, so.
Yeah, our health educators is pulling some of that stuff and putting it out regularly, so the message keeps going out.
Yeah.
And I think it's been discussed at the opioid group. I know.
We had like in September,
Yeah.
yeah.
Yeah, I wasn't aware that there was that many
Yeah.
resources, and it's obviously a very big concern.
Right. There is some concern with, well, brought up 2 weeks ago with Wasalfo. You might have heard Snohomish County was finding meth and fentanyl, trace amounts on the buses and things. And the conversation is, at what point do you do an intervention and do a required cleanup? What's the kickoff point for something like that? How do you deal with it in a hotel room or an apartment? So we're trying to come up with some guidelines that aren't too onerous.
Right.
So and LNI is wading in on that, and I would hope that they coordinate with the Department of Health and not just leap into it on their own. On the 5th and 6th of December, we have someone coming from Montana to do professional resiliency classes. It's a compassion burnout over time, and an expert at dealing with that. So we'll have a day of talking about it, kind of finding out where we are all at with that, and then the second day is learning coping skills to use going forward, because we can have something else coming. And it's, in public health, there's a kind of a stress that's there all the time. That anytime you're interacting with the public around health issues, it can be stressful. So
Yeah.
that's our FPHS, the Foundation of Public Health Services money, is paying for that. So she's coming in and doing a couple days of classes, and it's something I think that's really important for our staff.
I think healthcare everywhere is just a little burnt out.
It is.
After. Yeah, there's been a lot of quitting and retiring. Yeah,
Yeah.
there's not enough providers.
No, and I think that the OB practices are probably the hardest hit right now. It's really hard to find and then and physicians. So there's a lot of places around the state that are closing down their. It's difficult to stay in small communities. You know, then you
Right.
start taking your care to larger communities, and then if you, as long as you're gonna be at the larger community doing OB work, take all of your medical care there, and then it's just a spiral for rural communities. It's really tough to deal with, so that's on the, definitely a concern at the state level with the rural communities. How do we keep those services in the rural communities
Right,
so people can live in the rural communities that they love?
yeah.
Great. Anything else for Dave? All right. Moving on to environmental health.
I'll share my screen so we can look at things together. Not that there's a whole lot to do. Questions about the environmental health report? The main one on there I want to highlight is really that was really bad, but some really great on the part of the North Carolina Health Department to detect that, because they were, usually it's like, it's the old house we're living in, it's this, it's that, it's the windows, it's usually something environmental. Really, I had a hard time with it. The Dollar Tree that was selling this product in our area, and Sunny went out and made sure everything was pulled from the shelves. But it has a very long shelf life, so anyone that has this product, we really want them to, go through their pantry and make sure they don't have any more of it. Because it
How are we
was,
giving, how are we spreading that word?
we were doing outreach through social media for the most part. And the state has had tons of outreach too. Yeah, it was really, really bad. I have family friends who were eating that product, so, yeah. Other questions, I don't think there's anything else I wanted to highlight in here. So I have several memberships when we, I can't remember how many meetings ago, and that caused some change ups. And we have several applicants for the onsite sewage advisory committee. I guess we can start with, let's start with Vlad. Mason County Environmental Health Representative on this committee was Rhonda Thompson, and she has 8 years in the onsite septic field experience. Doing, sanitary surveys and septic pollution sources. Do an interview, or if you want to approve or deny, I don't know
Yeah.
what your preference is.
Well, what is this is still just a regular county thing, so it doesn't usually go through the county commission when we interview. If we haven't met them before, we usually interview.
Well, for this one, it's in the Board of Health, but in that it would be approved by the Board
The
of Health.
Board of Health.
And that's what it is.
So is that something review at the January meeting?
I guess so. I mean, I don't know. I doubt you guys want to make a special meeting for an interview.
I'm just trying to think, even though we have things in the bylaws, you can't bylaw things out of responsibilities through bylaws and other. If something went wrong with this, does it fall on the county commission, regardless of if the Board of Health is doing it?
Well, the county code. The county code created the on-site sewage advisory committee and said the Board of Health will approve.
Myself about liabilities, risk pool for third parties. I always worry about that stuff. So if nobody else sees any issues, then it doesn't bother me.
His qualifications, I think he,
I mean,
At least
we
for
hired him
that.
to work in our
yeah.
public health department. I don't see how we wouldn't appoint him at least.
Now, well, is that not a problem though? as a citizen.
Oh, he's not being put in as a citizen. There's a specific position on this board of Mason County Public Health Representative.
To represent.
And do we have any other applicants? I mean, if
We
he's-
don't.
If he's the, maybe we should just approve it today.
Yeah, it's hard to get staff to volunteer for this position because it's an after-hours meeting, so.
We're all smiling. Yeah, we get it.
You don't. So what you're saying, we shouldn't wait till January to give, we don't want him to change his mind.
I'm not saying that, I'm saying.
When you feel that,
Yeah, to interview him, call him for an interview, we can do that, or you can interview him today.
You interviewed him? Good enough for me.
Dave did too.
Yeah.
aye.
All right.
So I make a motion, we approve him.
I'll second.
Okay, it's been moved and seconded to appoint Vlad, his last name,
Nekrotenko.
Nekrotenko, to the on-site sewage advisory committee. Any discussion? Those in favor say aye.
Aye.
All opposed? Motion carries.
So Thad Bamford is a current member holding the installer position, and he's up for either renewal or to put someone else in that position. He is asked to be moved from the installer position to our newly created O&M specialist position. He's been a great member and is, pretty much always in attendance unless he's sick, so.
Okay. And then for the other applicant, is it for this same position or?
It's for the installer position that
Okay.
Thad is vacating. Yeah, there's no competition for
Okay.
one position.
Do they work for each other?
No. Shane Maples has his own construction company, and on-site sewage installation company. Thad mostly does O&M and some installations with his own company.
Okay. So, do you want to walk through the other one and then maybe we can just take action
Yeah.
on them jointly?
Shane occasionally comes to meetings, and he was at, not the last meeting, but the meeting before that. And he's got a lot of experience. He's a contractor that's in good standing as far as his on-site septic certification goes. And he has lots of experience, so.
Any questions for Ian on either of those applicants?
And neither have any opposition to him that I can, so.
Yeah, it's not
It's not
something
a
we're-
sought out after position.
I used to think that, but we had our solid waste thing, and I'm always shocked. We get plenty of applicants for that, and they're always willing to serve on it. And they're very educated. It's a cool.
In the field that they're in.
Mhm.
So I make a motion, we approve Thad and Shane to the positions they've applied for.
I'll second.
So moved and seconded to approve Thad Bamford and Shane Maples, the sewage advisory committee. Any discussion? Okay, hearing none, I'll call for the vote. All in favor say aye.
Aye.
All opposed? Motion carries. All right, perfect.
Wow.
Dave, community health report? Okay,
So I don't know that Melissa had anything else to add, other than she's excited about WIC and
it was great to see the inclusion of some of the data from the co-responder program.
Mhm.
So that's good to see.
and they've done a lot about who has what responsibilities. Co-responders versus lead versus,
Mhm.
so. It seems to be going very well. We've had, they showed up at our office when we had an incident happen over there, so,
Yeah,
to help us out with that, so.
That's good.
It seems to be working.
Good.
great.
Good.
Any other questions or comments on the community health report? Okay. For discussion from the board.
If I may. So, January, we've got That's our first business meeting of the year. We need to look at board membership. So we have a board member to refill, and with Kathy leaving, there's that. And plus we have 2 positions actually 4 positions that are still unfilled. So I think that's an opportunity for that board meeting
Have you had
to,
any luck with the tribes?
so,
Tom Strong from Skokomish Tribe, and that seemed promising, and then,
No.
no.
and get the community announcements out so that we have something to work on at the January. Yeah, so the way the 5091,
The new one.
the Senate bill, yeah, that changed everything. You have to have membership equal to the electeds. So we've got 2 community members, we have 2 members from health, health related. And one of those community members was our folks from the fire district. So we'll be putting that out with, these are the categories that you can apply for. It's 2 users / community members, users of public health, and then 2 health electeds. If you add in the tribes.
Mhm. We've really got to get them on board.
Yeah, and this is not unusual. This is, problem occurs across the state, and I've
Yeah.
talked to Kirkpatrick, Kutz, Stephen Kutz.
Mm.
But it's been tough to get them to.
Well, and they say that it needs to go through the tribes. They have well, they want to reach out to the tribes to see if they can, so
Yeah.
it's a little different than,
And I think Vicki Lowe is their representative for the tribes as a whole, so I can reach out to her again.
Kutz is on the State Board of Health currently.
Yeah. Okay, so there's that. So in January, we'll have business around board membership. Hopefully we'll have business around board membership.
Anything else, board members? Special thanks to Ben. Connection a couple weeks ago. I was able to make it there. Mayor and the city were there, Sheriff Sperling, and then Mark Neary had an opportunity to attend, and it was really good. A lot of really, I think, interesting comments from the participants, and I thought Ben did a great job in putting that together with the Youth Connection. So
That's a lot.
give him our appreciation for that.
I think the city, we just got notice today that the city is going to be able to do an abatement on that property on Railroad.
Oh,
as you
okay.
point out. So
Yeah.
they went through quite a long process, a lot of documents collected. We did a health officer order in support of that, and they're going to do an abatement to get that property cleaned up, so
Great.
yay,
how they did
yay
that.
Shelton.
Yeah.
see how they did that.
I've got it.
Yeah. Okay. Next up is public comment.
Yes, I guess I will speak. So my name's Constance Ibsen, and I'm with the Lower Hood Canal Watershed Coalition. And regrettably, on the septic program and the environmental report that Ian put out. But on-seasons have been a main focus of the Lower Hood Canal Watershed since we had the first clean water district, I think, in the state. And people actually paid for 3 years a rate on their parcels, and at that time, that program where we tried to identify the septics, not go out and visit. It was a major effort. We are hoping that the county will move toward a sustainable routine septic program. And nobody ever seems to want to talk about septics. But We feel that it's really necessary. We just really think that everybody needs some predictability. Like every 3 years, you get your septic inspected. Doesn't mean it needs pumped. It's just like your heat pump, you just get that inspected. Then the industry will know, the realtors will know, the people will know. And we won't go lurching from grant to grant. I am not fond of this pollution identification correction because, as Alex Pacey, the previous environmental manager, noted, we spent about, in grant monies, but that is money that taxpayers pay, we spent about $125,000 finding 8 systems. Most of those we knew already about for years. And I think there's maybe one that's still outstanding that hasn't been fixed. And that's just way too much effort. And then you hire people and then the grant goes away. It's too much. So in the new rulemaking that will be come into effect maybe in 2025, a local management plan will need to be submitted, developed and done. We're hoping that we really look at that and also have ideas on how to implement it. So I'll say the 2 scary E's that I feel really need to be addressed in the plan, and that is more ongoing public education and also enforcement. There, I said it out loud, just to put it in your memory. And also, just talking about septics, we note that the county is starting to do some outreach on short-term rentals. We are pleased as punch. And main thing that and we already wrote the county, is that we would like, well, I'll just read this. Rentals, also known as vacation rentals. Septic systems are generally not being used as the design capacity and pose a possible impact to public health and the environment. So Mason County is developing a short-term rental ordinance to ensure that mandatory annual septic inspection is included in that ordinance. So we will be watching as that ordinance is developed, and we can work on language, but that's pretty simple. Annual inspection of each short-term rental.
Got a question for
Sure. Well, I was just gonna say, maybe, yeah, Constance, are you done with comment?
Yeah.
Oh, okay. I just didn't want to.
Constance, so some of that stuff I don't disagree with you at all, especially when it comes to the rentals, the worries that we have, but the thing I'd like to know from your group, if you don't mind finding out from them, that becomes a justification for us to tax individuals, basically put a fee on them that they're gonna have to pay every 3 years of about $650. Yes, you say inspection without pumping, that's only for gravity systems that can do that. Mm-hmm. And even then, sometimes they still have to pump them to inspect the gravity systems. Mm-hmm. So that becomes a fee, and if we do the same thing on the rentals, say I'm actually for very strict. I don't know if I'm the one that's the strictest, because others brought it forward. I just know that it's been a bane in our existence for all those people that live there and deal with it. But once a year for inspection on that, again, that would be a fee of that amount of money on them each year. So I'd like for you to consider that and think about other ways and options maybe to do it, that it won't be so extreme for fees or a cost on them for doing
So
it.
you want me just to address the short-term rental?
If you
the
want, yeah.
mandatory annual? Yeah,
Yeah.
because we have discussed that kind of ad nauseum in the group to come to that agreement. And the main thing is they're not being used as
I
designed.
agree.
And we all realize that. You come in, you have 10 showers, you run the dishwasher, a load of clothes, I mean, it's all over. And a lot of those are on the shoreline. And it's a business. They are making money off of the rental of that property. And there's fees for businesses. So, I mean, there's expenses that one has for a business, and one of them definitely should be to make sure that you're not damaging the environment or public health.
Well, one other part of that to keep in mind is, unless things have changed over the years, it takes 3 years to get that perfect ecosystem in a septic system, so that it's actually grinding thing, just like
We're
it's supposed to.
talking about,
If you-
remember, an inspection, not a pumping.
But they have to pump them, I'm a realtor, remember, they have to pump them to inspect them. Unless it's a gravity, and there's not as many gravity on the water. So they have to pump it to inspect it, and even if it's a gravity, they usually still have to pump it. There's a few that will get away with doing an inspection, just look at the baffles and see if everything's going out the way, but that's not a real inspection, that's just.
So let's check and see, so I don't know if that's true. So Ian, do we know whether a non-gravity system, like all others, need to be pumped before they're inspected? I haven't heard that before, so it's
Can
good
I-
that we're asking.
Go ahead.
I mean, there's different standards, and it really depends on the company you hire. If you get someone to do a thorough inspection, they have to pump the tank in order to see if there's cracks in the tank.
Right.
That's one thing I'll put.
And if
Okay,
it's a pressure system, they won't inspect it without pumping it.
really, is that true? We just don't know?
Well,
We've never
mine-
been able to find one in the real estate
Mine gets
industry.
inspected every year because it's not a gravity fed, so
Right.
mine has to be pumped up, so every year, we have somebody come out and inspect it, but they don't pump it every time.
Yeah, I'm talking about the tanks, to inspect the tanks, to see if it's working, that's different. In order to actually inspect the tanks on the gravities, they have to actually pump the stuff out to check them. For some reason, they're able to get away with that on ones that are not, that are gravity. They're able to get away with that, at least in the real estate industry. When we sell a home, we have to go through that process in this county. So we do it all the time. So every time you sell one, that's one of the first things that happens. We can save a lot of money for the seller if it's gravity, and they get a company that will do it. Some companies won't do it. They want to pump it or they won't inspect it, so.
Yeah, it's a professional standards thing,
Yeah, it's
where
a-
you're saying, I inspected this system, but I don't necessarily know what the state of the tank is. There
Yeah.
would kind of be like caveats.
And they won't sign off on it that way before sending it to
I
you.
sold mine last year with an inspection only on a fairly sophisticated pump system.
Yeah, well, I can tell you, we run into that in real estate all the time for what's accepted, so.
Yeah, I understand that in some cases, it's the pumper making extra money, saying, I'm going to pump it or I'm not going to inspect it. You know, that's their choice. But, you know, in my case, it came out, we did a thorough inspection of all the pumps, flows, you know, looked at all the laterals, and it did not need pumping.
I guess the point is, there's not a mandatory pumping requirement for the inspection. It's a professional standards
They
thing.
just they won't inspect it without it. That's what we run into in real estate all the time. Now, and yours, was that the one where you told them who you were?
No, that was a long time ago.
Okay, I remember that
And that's-
one.
And that's when I had him replace the whole system,
Yeah.
So,
because that was really a failure, I mean, it was
Yeah.
huge, yeah. And it, Constance, in fact, we just did, well, week before last, we, had, one of these rentals that we, signed off, said, do not occupy until
Yeah.
fixed. And we posted them, and, yeah, they jumped right on it, it's surprising.
We know how extreme they use those systems for those rentals, it's disgusting.
Mhm.
We had the one, years ago, I had you guys go out and it was coming out the ground in the driveway.
Yeah.
It's just,
So,
literally cracks in the driveway, it's coming out
we've
the
done a
driveway.
lot more enforcement lately, there's been a lot more
no,
going on. so-
I'm pleased that we're working on all the deficiencies, and hopefully a lot of them have already been corrected. So just get a clean database and then start. That was the first priority for the Watershed Coalition, was to get a database that's all cleaned up. And I know this is all really hard work. So are we saying that, do the rest of the people here have a problem with mandatory annual inspection on short-term rentals?
Well, I didn't say it was a problem, I have questions and issues that would have to be addressed on it, it's not a problem.
What-
I'm
oh,
not saying
not a
I would
problem.
vote against it, that's not what
Oh.
I'm saying, I'm asking questions on
So
it
do you
to
need
make
different
decisions.
words? I mean, I'm just saying
I
that,
don't know, we'll have to think about it and see what those costs are, because no matter what, how much was your cost?
Well, I think I'd even add to that, we're just now putting the survey out, so there's
Yeah.
gonna be a lot of input
Yes,
to review.
right.
And we don't even have a model policy to comment on at this point,
Yeah.
but I think, you know, I think your comments are well taken and, you know, certainly worth considering when we do put that policy together.
Right. So, Ian, I know this is being bold on my part, but we are having an on-site advisory committee meeting the following week,
Mhm.
like Tuesday.
Yeah,
Yeah, so do you think that we could just introduce this as, what are the costs? You know, what is the cost and what, I would like to
Well,
have
I
the
mean, you're-
professionals explain this
you're
all
a
to me.
member, so you can bring up any issue you want. There's
Oh,
a-
no, but if you could put it on the agenda, that would be helpful or
Um,
not.
Should
If
actually
you,
numbers
if you
like
have,
this,
if you have an agenda item, send Vlad an email.
Send it to Vlad,
saying, you
okay.
know,
And
here's-
he doesn't have to, but I think we should get ready and discuss it, right, okay.
And I would probably share with them Kel's survey as well.
Yeah, and Kel will be at the next meeting.
Oh, perfect.
Kel or Marissa?
Kel will be at the next meeting.
Oh, Kel will,
Mhm.
oh, okay.
Yeah, she's going to talk to the group about, you know, various planning requirements related to on-site septic permits.
Okay, she'll be at the, okay, and then there is also the Clean Water District meeting the same week. Okay. Okay, thank you for listening, okay.
Thanks, Constance.
Always.
Okay, with that, we've reached the end of our agenda and would entertain a motion to adjourn.
So moved. Second?
Moved and seconded, we adjourn. We are adjourned.
Just go there, it's easier.
Yeah.